To me, integration is a philosophy. It's something we always have to have continuously in mind. Integration is not just about cost savings coming together. It's about how do we make the patient journey better? How do we achieve elimination of silos? How do we make it easier for families to get information? How do we make it easier for people to go to one place as opposed to 4 or 5? How do we get hospitals working together? How do we get health service providers working together in an integrated? And it's always got to be top of mind. It's a philosophy. It's something we always have to be thinking about at all times. Integration is not just about money. It's not. Integration is about making a more efficient system. There is a $25 billion deficit in the province at this point in time. There's going to be limited dollars for healthcare to add on. What we have to do is to integrate the system, make it more efficient, make it better, and the cost savings achieved can then be reinvested to make the system better for the patient, to provide service for the patient. The cost savings achieved by integration is one side, but the peace of mind for the family and the patient in the journey and the better care that they'll get through integration is really the ultimate aim. The board has decided to take a much more active role in integration in that we are working board to board. The board of directors themselves in their planning areas are meeting with boards, talking about integration, encouraging them to view integration in the way I described. To also, as boards, when you're at a governance level, your focus should be on the patient, the best care for the patient. And board to board, talking about integration, talking about the system, talking about making it better, a flow, getting rid of the silos, and talking to the boards about their role, they're there, what is the best way, what does integration look like in their area, how can they achieve integration, what is it they see they want for the patient. That's our role, to encourage them to think that way, to move in that direction. And then, if necessary, to provide operational resources to, in fact, advise them and have their CEOs work closely with the staff of the Northeast LHIN to achieve better integration. To me, it's a system that has no silos. The patient journey from one end to the other is a journey of health and wellness for all. The patient entering the system doesn't have to worry about where do I have to go from here, what do I have to see, where do I have to go, what do I have to do. The family shouldn't have to be worrying. The system at this point in time, it's a good system. It needs improvement. It's not patient-centered. It's not built around what is best for the patient. It's based around we develop a system. And it's based around working and making it easier for the people inside. And now we've achieved that level. The next level is to now say, okay, there's a patient. How do we change that system to be patient-focused, patient-centered, and have the patient as the center of care and of thought and of philosophy? That's what we have to do. I think under the HAPS process, where we're actually starting to bring hospitals together in clusters, actually hub hospitals in the Northeast in 4 sectors, to work together to look at a common budget, common problems that they have, and in fact having not one hospital unload their problems to another hospital, which causes a deficit there. It may in fact even out their operation. But it's not the best for the patient at all. They have to work together, they have to plan together. If somebody in a hospital has to close down for a month, then the other hospital should know and be prepared to absorb the extra patient, so the patient doesn't have to be affected by that. They're able to talk together. We're actually meeting as chairs and developing a vision for the 4 hub areas, and a vision. We have a vision from the 4 hub hospitals, their chairs, the Community Care Access Center and NEMIC, on a regional basis, on how they see acute care in the Northeast and a path and the best way that they can work together at a governance level for the benefit of the patients. And now we're doing that in the 4 hub areas, and we have all the board chairs coming together to have a discussion on their mission vision and develop a vision for their area and a mission for their area. So as they work together, they're working under the same vision mission. Ultimately, what we intend to do is take all 4 of them together and develop one mission vision from their combined work for the Northeast, so that the Northeast then is speaking with one voice for the Northeast for acute care back to the Ministry of Health. See, this is what the acute care sector sees for Northeast for the best for our patients. We're going to do that in mental health and addiction and down through the levels as we go. And that's, to me, that's a very progressive thing, that we are going to speak with one voice, and we will get together and the board chairs will know each other. They'll have a relationship. There will be a level of trust built. It won't be competing with each other. It won't be trying to steal resources from each other. It won't be doing doctor recruitment or professional recruitment on the backs of another hospital. It'll be doing it for the aim with the patient in mind. And the patient is where we're going, always, always, always. We are going to increase board-to-board relationships as we go. We're looking at doing a conference in the Northeast with all the board chairs coming together. Talk about integration, talk about patient flow, talk about what's best for the patients in the Northeast and their families, because families play a huge role in healthcare. That's a start of moving forward. We have to get rid of the silos. We have to get to know each other. We have to build a level of trust. Without trust, we go nowhere. And I think we're working to, the LHIN now is after a 3-year period, the LHIN has come to a level of competency and has built trust, which is something that had to happen when you're first out there. And we sat and we have accountability agreements with all the health service providers out there, and we're comfortable in doing that now. The next step is, where do we go? How do we get to the next level to actually move the Northeast forward, so that we're moving patient care to a higher level, that we're moving consideration of the patient, always, always, always. And it's the philosophy of integration that we have to be thinking about always. And it's not necessarily about saving money. You're hoping you will if you do that. But it's always about, we're going to integrate to make the patient's journey better. The patient's at the center, and that's where we're going. And that's going to be the target for the board. We are out there, we just developed an integrated health service plan with a huge consultation in the Northeast, huge amount. And we have 9 priorities out there, and we have it. And now it's up to the board and the governance sector to say, here are the priorities. We talked about it, we developed this. What is it that's necessary from us to drive those priorities forward to make the patient journey better? That's really where we got to come from. Yeah, I mean, we do have a telephone number. We do have a website where they can contact us. It's available. It'll be on the screen. But what the board has a policy. The board has a determination that within their planning areas, if somebody contacts our office here, we will arrange for a board member to go and talk with them, to speak on governance, to answer all their questions, to talk about the IHSP, to talk about working together, to talk about the HAPS process. We're committed to that. We are committed. As a chair, I'm committed. I can't cover the entire Northeast, but the board members in the planning areas are going to have the same information that I have. They have the same desire to work with the governance sector out there. We're very happy to do so. That's our role. That's why we're here. If they contact us, we will arrange a time to meet with them at their meetings. We will travel to where they are. And where possible, when we talk about integration, if we can have more than one board together at one time, if in fact we could have a regional meeting or a small meeting of 4 or 5, I'd be very happy to go with the board member to speak. There's 200 and some odd health service providers in the Northeast. It would be better if we did them in clusters, but we will go to individual organizations if they request. There's no problem. That's exactly what we're here for. That's how we intend to carry out our governance responsibility.